Hello, my name is Samantha, and I'm a social worker who specializes in families. I'm here to talk to you about structural family therapy. Stick around till the end as I will be answering any questions. Enjoy! The purpose of this presentation is to inform families of an evidence-based and research-based family therapy that is proven to be effective. My hope is that after this presentation, that you will feel more comfortable to pursue therapy and more informed. Family structural therapy is exactly what it sounds like it would be. The therapy focuses on repairing the structure of the family. So, you might ask, well, how do I know if the structure in the family is broken? Well, let me tell you, because according to the theory, there are many indicators of a dysfunctional family. One is rules. If the rules in the family are not being reinforced or are not existent, this could be very problematic. Boundary violations are a clear indicator of dysfunction as well. Too rigid of boundaries may lead to dysfunction. For example, one may be unaware that a child is even depressed because of the boundaries that are intact in the family. Dysfunctional families cannot handle the pressure of certain circumstances that happen in everyday life. They fail to accommodate and adapt to the situations. Hierarchies are something very important as well. They can be rigid, unfair, weak, and ineffective, leading to a lack of guidance, growth in individuals, and power struggles. Lastly, cross-generational coalitions can develop. This simply is, for example, parents arguing through their children, and one of the children becomes enmeshed with one parent, leading the other parent to become disengaged. A functional family is a family who is willing to be accommodating. You try to agree on major issues and daily rituals, and even if you don't, you work together to compromise. Healthy families will make sure that multiple boundaries are set to protect the unit. The couple should not overstep bounds by calling each other constantly while the other one is at work, for example. There are still two individuals, and those two individuals still identify as a separate personality, completing tasks and activities by themselves. Same thing goes for when children are added to the mix. Subsystems are being created, and a healthy family will understand that, but still protect the structure of the parental subsystem and the children's subsystem separately. Both the genogram and the ecomap are diagrams that work as helpful tools to us social workers. A genogram is useful in assessing large families. It is basically like a family tree, except it goes beyond that. It shows the relationship between family members, shows behavioral patterns between members, and psychological factors, as well as hereditary factors. An ecomap is somewhat similar to a genogram, except it shows the relationships to one's environment. Just a few key points to make about what structural family therapy is all about. It is important to note that therapists make no assumptions on how families should be organized. During the assessment portion, a lot of the therapist's role is simply observing the family and seeing how they respond to each other's dilemmas. Some of the therapeutic techniques that you will see a structural therapist using is joining and accommodating, enactment, structural mapping, highlighting and modifying interactions, boundary making, unbalancing, and challenging unproductive assumptions. Let's quickly cover a few. Enactments are an important part of structural therapy. Enactments encourage members to talk to each other in therapy. A therapist can discover many things by witnessing an enactment. Modifying is a way of changing the problematic interactions between members. They do so by using a technique called intensity. And to no surprise, the therapy uses a process called boundary making, which we covered in the previous slides. Those are the main key points to remember about structural family therapy. Well, thank you all for attending today. I hope you enjoyed today's presentation on structural family therapy. I am now open to any of your guys' questions.